Okay, shall I let the team participants in?
Yeah.
Okay.
Dr. Yeah, please check to make co-host. Just
Yes,
check whether
yeah,
everybody is
yeah.
the team participants.
I made everyone co-host. Okay. Okay, the participants who have joined till now, I request you to please change your team name to the new name within team's name A, B, C, D, E. So please change after that, and then we will start the quiz. Team 35 and team 10, I think your names are not renamed yet. So please rename it to the new team name. All the teams are requested to turn on the video and audio as well. Okay. Only team D is left to join. Okay. Okay. So I think all the teams have joined. Team A, B, C, D, E. Okay, I think Dr. Rubina, you can start.
Okay, thank you, Dr. Ria. Okay, so good afternoon, everyone. I, Dr. Rubina Saha, Acting President and Vice President-elect, welcome you all to the grand finale of IACFM National Quiz Competition. I would first of all like to congratulate all the participants for making it to the grand finale. The Indian Association of Community and Family Medicine was formed with a strong belief of promoting the community medicine and family medicine postgraduates in the field of academics, research, and clinical side. And I would encourage to become for you all to become a member of this association. Now, not wasting much time, let me introduce to the quiz master, that is Dr. Pracheth R, sir. He has done his MD Community Medicine from SDM Medical College, Dharwad in the year 2014, currently working as an Associate Professor from the Department of Epidemiology, NIMHANS Bengaluru. He has more than 9 years of teaching experience and has been involved in several grants for his research from ICMR, Union, and NTEP, to name a few. He presented over 35 papers in international, national, and regional conferences and is one of the academic editor of for PLOS ONE and reviewer for several eminent high-impact factor journals. He has won over more than 12 awards for his paper and poster presentation and is the recipient of the Dr. Shushila Nair Memorial Young Leaders Oration Award. He has over 35 publications in peer-reviewed PubMed Scopius Index Journal and has authored 2 chapters and two projects manual by he has been involved in over he has also been involved for over 200 various public health activities. So we welcome you to the national quiz, and I would like sir to share his thoughts regarding the quiz. So a few words, sir, about the quiz.
Thank you so much, Dr. Rubina. I thank the organizers for making me a part of this. So it's indeed wonderful. It's a great initiative taken by the Indian Association of Community and Family Medicine to bring together postgraduates from various medical institutes. So I don't think such an attempt has been carried out before. So it's indeed a commendable task by the entire team. And it's nice to know that so many teams participated in the prelims, and it was a very rigorous and intense process. You know, all of you went through it and you have got selected for the finals. So my suggestion to all the participants would be to enjoy this particular process. You have reached the finals. That means you're good enough to win this particular competition. Enjoy the competition, enjoy the entire process. So that's it from my side. Thank you.
Okay, so thank you very much, sir. Now I would like to introduce our moderators, Dr. Ria and Dr. Haripriya. Dr. Ria is currently Assistant Professor of Shantiniketan Medical College, West Bengal, and has done her MD in Community and Family Medicine from AIIMS Patna, and has over 10 publications and has been a part of several national projects like the Covaxin trial, MIYCN, to name a few. She is currently an executive member of the IACFM and has been working day and night for the association. I welcome Dr. Ria. Then to welcome Dr. Haripriya H. She is also alumni of AIIMS Patna, and she is currently a senior resident in AIIMS Patna and has been a part of various national projects like the Covaxin trial, MIYC, and Minerva, etc. She is also an executive member of the IACFM and has been true support for the association. I welcome Dr. Haripriya. And now on the scores, as a scorekeeper we have with us Dr. Teja Rama, currently pursuing post-graduation in AIIMS Rishikesh in MD Community and Family Medicine, and has an experience of holding several quizzes as well as the preliminary round of this IACFM. So now I would like to hand over the mic to Dr. Ria for communicating with the participants and giving further instruction. Dr. Ria, over to you.
Thank you, Dr. Rubina. So first of all, I'd like to welcome all the participants to this quiz, and very much congratulations on making it to the finals. So for the viewers and for the all the people here, I would like to just introduce the teams today. The first team is from the Maulana Azad Medical College, Dr. Ajanya V and Dr. Anshita Mishra. So they are team A. So we welcome you, team A. Next is team B from AIIMS Raipur. They are Dr. Veena G. Dev and Dr. Aswanth. So we welcome you, team B. I'd like to welcome team C from CONJNMH Kalyani and CNMC Kolkata, Dr. Sarmistha Chakrabarti and Dr. Mukta Mondal. So thank you for joining and welcome to the finals. Team D, they are from Gandhi Medical College, Bhopal. They are Dr. Kiranmai and Dr. Ashish Kumar Meena. So we welcome you. And finally, team E, they are from JIPMER, Puducherry, Dr. Abdul Basit KM and Dr. Ruben Raj. So we have a star finalists for our final quiz, and we welcome you all and all the best for the 4 rounds that you are going to be participating in. And each of the rules of the round will be read just before the round starts. Okay, so we will be starting with round 1. And I now hand over to Dr. Haripriya for introducing and starting the round 1. Over to you, Dr. Haripriya.
Thank you so much, Dr. Ria. So I would like to share my screen. So Dr. Ria. Yeah. So is this visible? Is the screen visible?
Yes, Dr. Haripriya, screen is visible.
Okay, so thank you so much. So once again, welcome you all to the grand finale of IACFM, this national quiz, and all the very best to all the. So we'll just go to the first round. So the first round is what if round, and the general instructions regarding this round will be given by our quiz master. So before entering into this round, I would like to say the flow or the pattern in which we are planning to conduct this round. So here, there will be two questions which will be asked to each participant. And basically, this will be a rollover question. So if any of the questions which has been not answered by any of the team, or if it is a past question, or if it was a wrong question, that question will be passed over to the next team. So to maintain this, to just have a monitor or check on this round. So first we will be we'll be creating a breakout room in which individually one team will be allowed to enter. And meanwhile, remaining all other teams will be in the main room. They won't be able to the questions. And first, once we finish that round for a particular team, then those team members will be coming out, will be asked to come out of, leave the room, and the next team will be allowed to enter into the breakout room. Is that clear? Okay. So if that is clear, so I will request our quiz master, Pracheth sir, to just please read out the instruction about the round 1. Over to you, sir.
Haripriya. Thank you, Dr. Haripriya. So each team will have 2 questions allotted to them. So we are going to start from team A, then go to team B, team Z, team D, and team E in a sequential manner, and then round back for a second time. All the questions will have multiple choices. The time for answering each question will depend on the difficulty level. Some questions may have 30 seconds, some questions may have 20 seconds. If the team, suppose one team does not know the answer, they have to say pass. They'll have to pass the question, and then the question will roll over to the next team in sequence. Suppose team A says pass, the question then rolls over to team B, and so on. Okay, so these are the instructions for the quiz, round 1. So in case of a wrong reply, in case one of the team answers wrongly, I will roll the question to the next team in sequence. Okay, and at the end, I will also try to roll out the question to the audience, following which the answer will be declared. Suppose we do not get an answer by any of the teams, I can roll it out to the audience. For every correct answer, the team gets 20 marks. Suppose it's a passed or rolled over answer and you answer it correctly, you get 10 marks. There's no negative marking here in round 1. So the team which will leave the breakout room will be allowed again, but they won't be given a rollover chance from the other teams. Next.
Yes. Thank you, sir. So this was about the instruction of the round 1. So, getting into the actual round. So first, team A will be allowed to enter into the breakout room. And so I request Dr. Ria to kindly let us in into the breakout room.
Yeah, okay, Dr. Haripriya. I'll create and then put the moderator, the scorekeeper, quizmaster, and team A into the new room.
Sure, sure. Thank you.
Dr. Ria, should team A enter the breakout room or the other team should enter the breakout room and team A should be in the main hall?
Team A, as well as the moderator and the quiz master and the scorekeeper will be in the breakout room for the first 2 questions. After that, the team will be asked to leave the room and the next team will be asked to enter. So I think now a screen on your screen, team A would have got that pop-up sign of joining into the room 1. So please join in.
Okay, so that the team A has joined, they'll be asked 2 questions allotted to them, and that's after that they will come out and then team B will join. If they had any questions passed from them, then the rollover questions will be passed on to you. So you will know that in the breakout room. Okay, so in the meanwhile, what will happen is I'll play an audience round question. So anyone in the YouTube who is watching, if they can answer, they can they will get some exciting prizes if they answer correctly. So in the round 1, the first question is like a scenario based question. Basically, a 50-year-old female with history of age-related diabetes presented to the PSC. She had multiple episodes of intractable non-bloody and non-bilious vomiting since 8 hours ago, leading to fatigue and altered sensorium. So on presentation, the patient was responsive to pain, but poorly receptive to verbal stimuli, dehydration, mild abdominal pain, and no urinary problems. BP was 123/81 and RBS was 250. She was administered normal saline and electrolytes, and within 72 hours, she was alert, awake, and responsive to commands within tolerating the oral diet. Serum sodium levels were now within normal range too. So what is this condition called? So for the audience round, this is just for the YouTube audience, not the participants here. So participants are just requested not to tell the answer even if they know. And for the YouTube members, you can just answer starting now. This is just a taste of what the round 1 is like. So just getting familiar with everyone. After the time limit ends, if no one in the YouTube answers, then we will ask the answer from the rest of the teams here. Okay, so YouTube, we have a answer right now. So I'm stopping the timer. Dr. Samar Hussain, he has answered the first option 4, followed by Dr. Navami S, who has also answered 4. So we will just take the participant who has answered the first. And now I'll reveal the answer. It is indeed 4, diabetic ketoacidosis. The blood sugar level was higher than normal, accompanied with intractable vomiting but absence of fever. And she had mild abdominal pain, ruling out acute appendicitis, but no urinary problems. and she had forgotten to take her DM medications. So this diabetic ketoacidosis also leads to hypo or hypernatremia. Okay. So Dr. Teja, our one of our scorekeepers, has asked Dr. Samir Hussain to please share his email ID here in the YouTube. So we will share our exciting prize that we have IACFM has to offer to Dr. Samir Hussain. Congratulations. So if I think team A is still busy, so we can proceed with the next question. A 28-year-old woman visits for preconception consultation. Her seizures are well controlled on medication, which is the most important advice to give to her. So there are four options that you can see on the screen. So now the time starts. Which option is the correct one here? The YouTube is like a minute delayed, and yeah, it just started now. So for question 2, okay, Dr. Samir Hussain has said 1. The first answer came. Anyone else? Okay, just I'll ask the participants to wait just a bit longer, like 10 seconds. Once the timer in the YouTube, okay. Dr. Navami S wrote 3. Okay, very good, Dr. Navami. You have answered correctly. So, Dr. Navami, you also win an exciting prize from IACFM for question 2. Congratulations, Dr. Navami. So, the answer is indeed number 3, preconception, folate supplementation. So, women considering pregnancy should be avoided to take a daily supplement, advised to take a daily supplement of 400 to 800 microgram of folic acid and continuing it for 12 weeks. A higher dose of preconception folic acid is recommended for women having seizure disorder, insulin-dependent diabetes mellitus, or any family history of neural tube defects. Okay, so I think for now we can stop the audience round here, and we will again share the audience round once team B gets into the breakout room. Okay, so team A has joined back. Now I'll assign team B into the breakout room. Team B, you should be seeing the option to join. Okay, so now that team B has joined, we will again start the audio round. Another instruction for everyone is when you go into the breakout room, please unmute yourself in the breakout room itself. Okay, that is a very important instruction aside from keeping your video on. So now we will start sharing the audience round again. Okay, so the third question. A 38-year-old pregnant woman visits ANC clinic at 12 weeks POG and requests a genetic screen out of concern about her advanced maternal age. She wants a non-invasive test with a high detection rate. Which of the following should be the most appropriate to offer this patient? So the options are: if no prior personal family history, no genetic screening needed, refer for nuchal translucency screening and HCG, refer the patient for CVS, and discuss cell-free DNA testing and refer. So the time for the audience starts now. Okay, everyone is writing 2. Okay, a little bit time left.
रोल ओवर करके हमें देंगी ना आंसर. हाँ. Ma'am, do we have to do anything for this question?
No, once for the audience round, you mean?
Okay.
Yeah, audience round, this is happening. So if no one in the YouTube can answer, then we will roll over the question to you.
Okay.
Everyone here can answer if they want. I'll announce that. Okay, so the time has ended on YouTube. So if anyone from team A, C, D, and E can answer the question.
Answer 4. Discuss cell-free DNA testing and record.
Okay, team A. So let's see the answer. It is indeed answer 4. Discuss cell-free DNA testing and refer. So cell-free DNA testing or prenatal aneuploidy screening has higher sensitivity than nuchal translucency in the first trimester, and it shows the risk for having a baby with aneuploidies. Only blood sample required, and it is less invasive than the CVS, that is chorionic villi sampling. Okay. So now the team B, I think it is over. I'll stop sharing the screen once more. Okay. I think team B is not in either of the rooms. Then
We are in the main session actually.
yeah. Shall I then just wait a minute. Maybe team C has to join now. And just a reminder that if you keep your audio off, okay, then negative marking is there. From the first team itself, negative marking that will be there for if the audio is kept off. Okay, so -10. So please just be aware that do not keep your audio off.
In the breakout room or even
In
here?
the breakout room. In the breakout room. Once you join the breakout room, please unmute yourself. Okay. So team B, I don't think is there.
Whenever in all the rounds, whenever you are attempting the question, make sure that you please on your mics. Not only in the first round, in all the rounds, whenever all the teams are attempting, make sure you on your mic and also the video. Then the -10 will be allotted, or else.
Okay, so I am putting team C. Please be ready. Okay. Okay, so now that team C has joined, we will move on with the next audience question. Yes, so now we will move on to the fourth question. An outbreak of gastroenteritis has occurred in a student's hostel. The reason was contaminated water. So how much bleaching powder is required to purify the water in the hostel tank of capacity 20,000 liters? Okay. So the options are here: 25 grams, 50 grams, 75 grams, and 100 grams. For the YouTube, the time starts now. 20,000 liters, how much bleaching powder is required to treat the water? YouTube viewers, please answer the question. We are getting answers right now. We will declare the correct answer after the timer ends. Thirty seconds left almost. Anyone else wants to answer? Okay, so the time is over right now. Yes, the time is over in YouTube. So anyone from the participants, they want to answer this question? Participants of finale?
50 grams.
50 grams.
50 grams.
Okay. Anyone else?
Option 2, 50 grams.
Okay. Anyone else? Anyone wants to answer? 50
50
grams is not
grams.
the right answer, by the way. I just told you 50 grams is not the right answer. Okay, so I'll share the answer. It is 100 grams because during any outbreak, the recommended amount of bleaching powder to be added is 5 grams per 1,000 liter, not 2.5 grams. Usually it's 2.5 grams is added, but during an outbreak, the recommended bleaching powder is double. So hence 100 grams is required to disinfect 20,000 liters of water. So we will now proceed maybe to the next question, or if I'll just check if the team C is done. Team C is still ongoing. Okay, so then we can proceed with the next audience question. Question 5. A 3-year-old child presented with rapid onset of weakness in his legs and is continuously vomiting whatever fed. He cannot walk properly. The symptoms have started appearing 10 days back. What is your next step of action? So now that the question has been read, I'll just repeat the question again. Rapid onset of weakness in his legs and continuously vomiting whatever fed. Symptoms started 10 days back and he cannot walk properly. So what is your next step of action? So the options are here and now. Your timer starts now. You have to answer which is correct. For the YouTube audience first, you have 60 seconds.
तो अभी तो रिसेंटली हुआ एमआर वगैरह के कैंसिल नहीं है ओ सॉरी अभी
Okay. Dr. Samir Hussain has answered the 3. Navami S has also answered 3. So now that the options are here, the correct answer has been given. It is indeed 3. Dr. Samir Hussain, again, congratulations. So the answer is alert the authorities about AFP and refer to higher center. The child has presented with rapid progressive weakening of limbs and difficulty swallowing food, indicating acute flaccid paralysis. So the AFP surveillance network should be alerted, stool sample sent, and the child referred to the higher center for management. Okay. So the scenario-based questions have ended right now. We have more questions for store for the audience. Let's see if the team C is done. Okay, I think team C is done. Team E. Team D has, okay. So team D has joined into the breakout room. Now that the team D has joined the breakout room, we can proceed to the next question in the audience round. The next question is supposed to be in the later rounds, but we will just proceed. Okay. Question 1, these are not scenario based anymore. Question 1 is, what is Elena? These are 30-second questions. So your time starts now. For the YouTube audience, okay, so the YouTube audience has answered 1, 3, and 2. Okay, so again, I think now the time has ended. It is time to declare the answer. I think Dr. Samir Hussain is well read in all these community and family medicine topics. So yes, it is a WHO database. It is the e-library of evidence for nutrition acts built by the WHO, and ELENA aims to help countries successfully implement and scale up nutrition interventions by informing as well as guiding the policy development and program design. Okay, so the question 1 has ended. We'll move on to question 2. What are the histological findings of psoriasis? Again, your time starts now. Very good, Dr. Nishant Ramaswamy. You have answered 3, acanthosis. That is the correct answer. So the answer is acanthosis, parakeratosis, and Munro microabscesses, because the histology of psoriasis is characterized by epidermal acanthosis, parakeratosis, and microabscesses, and thickened projections of the prickle cell layer of keratinocytes, psoriform hyperplasia, and there is no granular layer. Okay, so let's see. Okay, so the team D is still ongoing. So now we'll be putting team E. Yes, team E, please join. Okay. So now we can proceed with the next questions in the audience round. Question 3. Ventricular septal defect is the most common congenital heart defect. What condition is it most likely to be associated with? Your time starts now. In the meanwhile, I asked Dr. Teja to please keep note of the winners here in YouTube. Okay. My lucid life has answered 2. Nishant Ramaswamy 2, Samar Hussain 4, the Snow Monster 4, Jaya Gokul 3, and Nikita Gupta 3. So, which is the correct answer? The correct answer here is fetal alcohol syndrome. Fetal alcohol syndrome, it is a condition in a child that results from alcohol exposure during the mother's pregnancy. And fetal alcohol syndrome, they cause brain damage and growth problems such as abnormal facial features, low body weight, sleep and sucking difficulties, macrocephaly. And cardiac abnormalities include defects to AV valves, ventricular septum, and enlargement of the left ventricle. Okay, so now we will move on to the next question. So this question winner is My Lucid Life on YouTube. So please, whoever winner is declared, please share your email address on the chat, or you get back to us when in the final the email is shared to everyone, the email of IACFM. You please contact us and just let us know, then we will send you your cash prize. You have to get in contact with us, otherwise it's not possible for us to send you the prize. So please just let us know your details. Okay, so now we move on to the next question. Question 4. Which of the following should be avoided when weaning a child of 7 months? Your time starts now. Okay, so my lucid life is 4, Nishant Ramaswamy 4, no monster 2, Komal Shalke 4, Nikita Gupta 4. One of them is the right answer, obviously, among 2 and 4. So now we will declare the answer. It is number 2, honey, because babies may naturally prefer sweet over savory foods, but sugar can lead to tooth decay and putting on too much weight. All these types of sugary products should be avoided. Fruit juices should be well diluted, 1 part juice, 10 parts water, and only ever be given in a cup at meal times. So this is the question 4. And Just a minute. I'll just check if team E is done or not. Okay, team E is still ongoing. So we will proceed with the fifth question for now. Which of the following is not one of the three transformative results, aka 3 zeros of the UNFPA by 2030? So your time starts now. Okay, so the last answer is okay. So Dr. Navami S has answered 4 as well as Dr. Lucid Live. Then Chaitra Rohini answered 3, Snow Monster answered 2, Nishant Ramaswamy answered 3. So the correct answer is number 4. So congratulations, Dr. Navami. Congratulations, Dr. Navami. So they are the ending preventable infant deaths. UNFPA is committed to achieving by 2030, ending preventable maternal deaths, ending the unmet needs for family planning, ending gender-based violence and harmful practices, and the other is not there. So now the breakout rooms are about to close. I'll just stop sharing my screen. And all the participants and everyone will be, yes, everyone is now back. Okay.
Dr. Ria,
Yes.
now the first round, all the team members have got their respective questions, but still we are having another 4 rollover questions.
Okay.
So which will be asked to team A again. So
Okay.
I would like you to create a breakout room once more and allow us inside so that, and again we will start the rollover from starting from the beginning. Team A can get inside and we can ask them the rollover questions. Is that clear?
Yeah, okay. I'll just create another breakout room.
Yeah. Thank you.
Team A and everyone
Do
in
not
the
switch
first
off your mic. Please do not switch off your mic. It will lead to minus -10. All the teams are requested not to switch off their mics. Please switch on your mics. Otherwise, I'm going to give -10. This is the last warning. I've already deducted -10 from team A.
Okay. So everyone can join now.
Excuse me, ma'am, should we put on the mics for the whole time?
It's better if you can. Okay.
Because earlier we were advised to unmute only when we were in the rooms.
Yes, because we were, now before it was because we were giving instructions and reading the questions, that's when. Otherwise, it is better to keep your mic on. Okay. Otherwise, just because talking in the background creates a disturbance in our conduction of the quiz as well. That's why. Okay, so these rollover questions will be happening very fast. So I'll not give any audience questions for now, and just wait till all the rollover has been done.
My God.
कहाँ गया? Open breakout rooms, wait to be assigned.
I think
क्यों नहीं होगा शायद अभी सबको सबको एक चांस मिल चुका है.
एक को नहीं मिला होगा क्योंकि उसने फर्स्ट किया ना. बजर राउंड कैसे करेंगे इसमें?
नेगेटिव मार्किंग किसकी है? टीम बी बोला था, टीम डी बोला था का? Don't react. Don't look.
क्या चल रहा है?
पीसी डी एक आ गया.
ब्रेकआउट.
अच्छा.
So I'd ask the teams here, meanwhile, that how was your experience for round one? Team B can start sharing the experience.
Actually, it was good experience, ma'am. Like the questions were also good, and it's mostly practical oriented questions. So that's
Okay.
usually we are coming across in the daily life. So it
बाकी
was
3
like
क्वेश्चंस मिलेगा ना बाकी उनको.
Okay. Thank you, Team B, for sharing experience. Team C.
it was nice experience, ma'am. All practical
Team
oriented.
C, can you share your experience? Yes.
It was a good experience. First time we had entered this sort of online quiz experience. For me, it's first time. So it's a new and exciting experience for me. And the questions were clinical oriented, so liked it.
Yes, these are scenario based questions basically. So everyone will get a different chance, and there are two types of question. One is for 30 seconds and one is for 20 seconds. We kept like that. So that one is a longer version for long case and kind of like a short case type. So I hope that was enjoyable for everyone. And the main thing is like enjoy the experience. If you can answer, great. That's really great. And so Team D, can you share experience?
Yeah, it was quite a good experience, and the options were too close. Like we were confused between two options, and that's why we did a couple of questions wrong because of that.
Okay. Okay. Nice. So, and it's nice to see that you guys are liking the challenge. That was our goal basically, to put for some challenging questions both for you and for the people who are watching. So from the round 2 onwards, there is no breakout room, right? So everything will be visible online for all the audience and everyone to see. All your other teams also you can see what you are answering. So Team E. Team E, can you share experience?
Yes, it was like indeed like tricky questions, and it was quite simple case scenarios, like which we will have to face as a public health physician. So it was interesting. Thank you.
Okay, okay. Thank you. Thank you, Team E. So, yes. Okay, so I think the scores are now being tallied right now. Scores are being tallied right now. And we will declare the score in like 5 minutes on a slide. Everyone can see on the main room that what are the standings of the scores. And based on this score, the ranking of the score, the participants will be able to do in the round 2. There is some special advantage for people who have scored in this round 1 for round 2. Okay. So, yeah. Team A was there in the breakout room first. So Team A, can you share experience? How was it?
It was a very good experience, ma'am. The questions were clinical based, and yeah, as one of the other team said, it was a bit confusing. Very close options and everything.
Yes. Okay. Okay. So I'm glad you're liking the challenge, because the next round can be a bit difficult too. Maybe in team first round was scenario based, but the second round is even more difficult. So you will understand when the second round rules are read out.
Thank you for the heads up, ma'am.
Okay. Okay. I'll just coordinate with the moderator there and let you know that if what is the time left for declaring the score.
मुझे नहीं पता उसमें
अभी तुम और हार्ड क्वेश्चंस होंगे।
पैटर्न चेंज हो जाएगा ना, तो शायद पैटर्न चेंज हो जाएगा।
इन सबका आंसर्स चाहिए। चाहिए।
So
Okay,
yes, so
yeah.
that was the end of round one, and we all are in the main room. Are we here?
Yes, Dr. Haripriya. I think
Everybody are
everyone
here,
is,
right?
everyone is here. Yeah.
Very
Yes.
good.
So
Yes.
that was the end of round one. So we need another 2 minutes to declare the scores of this current round. And
Okay.
after that, we'll proceed with the second round.
Sure. Okay.
रैपिड तो लास्ट में होगा।
I think yes. Thank you. Didn't give us answers for the other questions, right?
Okay, so the scores are now ready. They'll be declared just in a minute.
In there.
Dr. Teja, whenever you're ready. Yeah. Okay, so the team scores are now in. Sir,
Yeah, so these are the scores that we have. So you can see this. Team A is on 40, Team B is on 30, Team C is on 20, Team D is on 20, and Team E is yet to open its account. So no problem. You have many more chances. Two more.
Sir, Team C, sir, we have a query. Team C has answered one correct question and one past question. So our score should be 30.
So similar actually हमारा भी we answered one proper question and two rollouts. So हमारा तो 40 होना चाहिए.
May also answer
Oh,
two
please,
questions in a breakout
that would
room
be
and
the
one answer over back.
scorekeepers. You can please see that.
Ours should have been 50, right?
Scorekeepers, you can please address that query.
Team A, 10 marks was deducted because your audio was off. I think that's why.
Sir, ma'am, हमारा भी 40 था. Can you please look into that issue?
Yeah.
And our team A would be 50, I think.
What?
I would like to say, Team A had answered two questions and one passover question.
Yeah.
And Team B had answered one correct answer and two passover questions.
Yes, ma'am.
Team C
So
has
20 plus 20 to 40. It's it.
And our team A would be, ma'am.
Team C, ma'am, one correct question and one passover.
And Team C had answered one correct question and one passover questions.
Should be 30. It should be 30.
And Team B has answered only one question.
Ma'am, Team C score should be 30.
Okay, I understood.
Yes, it will be corrected. It will be corrected. So you have answered one direct question and one rollover question.
Yes, sir.
So that will be 30. Okay.
Sir, I hope team A has been given 50 points.
Team A, I believe 10 marks have been deducted to you.
Why, sir?
It was announced, no? That time, I don't know, the organizers.
Yeah, the audio was off. That's why we
Sir,
announced.
maybe because we were the first team to go inside the breakout room, so that is why maybe we did not know. But after that, in the second
it was already announced that time. It was already announced. So it is up to the moderator.
When we returned from the breakout room, then only we got to know that we are not allowed to
all the instructions and SOP has been given.
Everything has been given. Yeah.
Yes.
All
So
the
we
SOPs have been given. So we need to comply by that. Decision has been taken. This is how it is. These are the rules. Okay.
And Team E has not answered any of the questions.
Team E has not answered. So right. So that one correction in Team C, we will correct it. Don't worry. You have got 30
please, sir, we did not know about the breakout room, and hence
it has already, decision has already been taken. I am the quiz master here. The moderators have decided based on the rules that have been formulated and the SOPs that were already circulated before. Thank you. So let's move on.
We go ahead with the next round. So I'm going to share the screen. Sir.
Yeah, Dr. Haripriya just announced the final scores of the team for the first round, because that will depend on who can select for the round 2. There's a score dependent thing.
Really?
Dr. Teja, can you share the corrected one? Corrected scores?
But I did not.
Okay. So these are the modified scores of your.
Yes. So we have Team A, Team B, Team C, Team D. In the same order it is there. So I think we can ask Team A to choose first, right?
Yes, sir. Okay. For that, sir, we need to declare the rules of round 2. So Dr. Haripriya can share your screen. Yes, and share your screen.
The partner সেটা নিতে
So let's move further. So this is round number 2, which is choose wisely. So I will request our quiz master to read out the instructions.
So this is an audio visual round. So there are 6 sets to choose from. No 2 teams can select the same set again. So the team that has scored highest in the first round, which is team A, of course, will get to choose the number first. If there is a tie in the first round, the prelim round rank will be taken into consideration. Okay, so in prelim round, who has scored first?
Team A, sir.
Team A itself. So wonderful. So like I said, team A is still first. Fine. Each set has 4 questions. The teams will be asked their questions only. All the questions will have multiple choices. Time for answering each question is 20 seconds. After the hint, no time limit is given. Correct answer, 20 marks without hint. But if you answer with the hint, it is 10 marks. In case of wrong reply, there is negative marking of 5 marks. If there's a negative mark, please be careful. There will be no rollover questions. Quizmaster may roll out the question to the YouTube audience, after which he will declare the correct answer. That's all. So these are the instructions.
Sir, that means, sir, a doubt, sir. That means after display of the question, there will be a 20-second time run out.
Yes,
And if
there
you're
will be a
not
20
able,
seconds.
and if
Yes.
you're not able to answer in the 20 seconds, then we have to ask for hint.
Yes, the hint
Yes,
will be shared.
yes. And immediately after the hint, you will have to answer.
So first
You
20
can't-
seconds run out, and then we have to ask for hint.
Yes.
After the hint is given, immediately we have to answer.
Yes, you need not, without hint, if you want to answer, you can still answer. Right, but wrong answer, negative mark is there, 5 marks. Remember that. Even with the hint, if you answer wrongly also, you get negative mark of 5 marks.
Sir, the hint will be given only after 20 seconds. Sir.
Only after 20 seconds. Okay, after 20 seconds, we'll give you a hint, then immediately you need to answer. Okay, or if not, don't answer anything. It will pass. We'll pass it to the YouTube. Okay.
Okay.
Fine. So next, shall we move ahead?
We have a meeting with
Moderators?
Yes, sir.
Yeah.
Yes, sir. We are moving ahead.
confidence. Don't look at me.
So team A, you will have to choose one. Right?
I don't want to choose one.
What do you want to choose? You can choose any of these numbers.
Sir, 4.
Number 4. So let us go to number 4, please. Number 4. So this is the question: which national program includes the organism discovered by this personality? A, National TB Elimination Program. B, National AIDS Control Program. C, National Rabies Control Program, or National Vector-Borne Disease Control Program.
Sir, the options are not displayed.
Options are displayed. So your time started already. Time starts now.
D, sir. D.
D. So yes, it is absolutely correct. You have answered it rightly. So it is National Vector-Borne Disease Control Program. So let us move to the next question, please.
Sir, sorry to interrupt. All the team D, C, B, and E have got -10 because all the mics were mute.
Yes, so it is very, very clear. Do not ask us again.
Ma'am,
You will
actually,
have
can
to
I
comply
say?
with the rules.
No, sir. Actually, the host muted you karke aaya hai, sir. It's not from our part.
It's host muted you, ma'am. The host muted us.
Host muted us, not us, ma'am.
Not us.
Okay, we will check from our team side. If it is from our team side, then fault. But do
Yes,
not-
the host muted it.
Host muted, ma'am.
Okay, then we will just check on it. Okay.
Symptom of chronic cause of this.
Okay, we'll rectify that. No problem. So happens, take it in the right spirit. So we just want to ensure that the rules are followed. So, fine. Next question. Shall we move on to the next question, please?
Yes.
So question 2 for team A, which is the most common chronic cause of this symptom of respiratory symptoms system in infants? Options, please. You will have to listen to this. So what is it? These are the options that you have. Viral choanal vocal cord paralysis, or laryngomalacia.
Sir,
Yes,
option D, laryngomalacia.
laryngomalacia. Wonderful. You have answered well again. That's the correct answer. So it's very, very correct. So the sound is of a spider. So correct answer. So let's move to the next question. So a mother is feeding her 9 to 11-month-old child around 80 ml mashed food during each feed. Apart from breastfeeding, which measurement would you tell her to use for adding the nutrition? Okay. So next slide. So is it 15 ml, 60 ml, 85 ml, 125 ml? Your time starts now.
Guess. Pure guess. बोल दो कुछ भी बोल दो. Hint. Let me. Hint. Hint.
What is it?
Hint. Hint.
Okay. So let the time finish. So this is your hint. A child is fed around half a cup during the age of 9 to 11 months. Half a cup. So again, the same options tell us.
125 ml. The D 125 ml.
So that is the wrong answer. I'm sorry. So, fine. So as the answer has been displayed, now let's go to the next question. 35-year-old female presenting with sudden breathlessness and cough. She takes oral steroids sometimes to control her symptoms, but recently a sore throat has highly exacerbated her SOP. What is the diagnosis? So let's have a look at the options here. Is it COPD? Is it pulmonary fibrosis, asthma, or pneumonia? So SOB means shortness of breath or breathlessness.
Asthma. Sir, option C, asthma.
Option C, asthma. Very well done. So that is the right answer. So let's go to the answer slide. So chest X-ray shows no consolidation or low density areas. Therefore, this is the hallmark of asthma, as it has been relieved by steroids. So fine, well done. So I think you have answered one wrongly. Rest of them were correct. So next, let's go to the next team.
Answered question and one question was wrong.
Yeah, one was wrong. Yeah. Next, please.
Next team, that is team B. So team B, be ready. You can
Please choose one.
The 1.
6 is over, no? What is your number?
4 was over, sir.
4 was over. 4 is over.
Selecting 1, sir.
You are selecting 1, so let's go to 1, please. Okay, so this is your first question. You have 4 questions. Identify the organism given in the figure. Is it rubella, measles, respiratory syncytial virus, or influenza? So just 20 seconds to answer this. Your time has started.
Sir, hint.
Hint. Let's go to the hint. So after 20 seconds, the hint will be displayed. So the hint. This is your hint. The virus is transmitted by airborne.
Sir, respiratory syncytial virus.
So that is a wrong answer. Shall we pass it on to YouTube? No, okay, fine. The answer has been displayed. So the correct answer is measles here. So the next question. Identify this famous personality. Is it Guy Paget, Jon Snow, James Lind, or Jean Nicholas Demarque. Who is this famous public health personality?
Sir, option D.
Option D. So it is the correct answer. Well done. So it is Jean Nicholas Demarque. Let's go to the next question. So he was the one who found out microfilaria. Next question: which symptom can you hear here in a COVID-19 patient? Let us listen to the audio clip. So what is that sound? These are your options. Is it wheezing? Is it bronchial breath sounds? Is it diffuse rhonchi or acute respiratory distress? This is your third question. Your time has started already. Just 20 seconds to answer this.
Sir, option B, bronchial breath sounds.
Option B, bronchial breath sounds. Well done. So you have answered in the nick of time. Very good. So in mild pneumonia phase of COVID-19, bronchial breath sounds can be heard. Well done. So you identified it correctly. So here's the last question here. Identify this disease. And you have these options: Hansen's disease, rheumatoid arthritis, rheumatic arthritis, or acute porphyria. Your time starts now.
Options.
Yes, hurry
Sir,
up.
can we ask for hint?
Yes, let us go to the hint now. So this is your hint. So there is acute arthritis affecting the small joints of the hand.
Sir, option B, rheumatoid arthritis.
So I'm afraid that is the wrong answer. So is it going to be posted in YouTube to the
Yes, sir.
audience? Yes.
Pass this to the audience.
You can pass it to the audience. We'll pass this to the audience.
You can just go back to this the other slide.
Yes. So let's go back to the team slide now. Next team can be invited.
Yes.
Sir, answer for that question can be.
No, we will let you know later because otherwise the audience will unko maza nahi aayega na.
Okay.
Fine. Okay. Definitely not what you answered. That's all.
Okay.
On a lighter note. Okay. Fine. Next. Who's the next team, please? Team C. Team C, your choice is there here. I believe number 4 and number 1 are already over. They've been taken.
Number 6.
Number 6, very good. So the last number looks like you want to hit a sixer. Fine. 6. Let's go to 6. So this is your first question. Which method has been used here for distinguishing between the two? Pure and adulterated milk. So these are your options in the next slide. Next slide, please. So shaking the milk with water, adding soya bean powder to the milk, shaking the milk only, or adding detergent to the milk. What exactly it is?
The hint.
So let's go to the hint, please, as requested by the team. So here, change of color is not detected here.
Sir, option D, adding detergent to the milk.
Option D is the wrong answer. Sorry, it is not the right answer. So the right answer is shaking the milk with water. It is done to check for detergent in milk. Okay, so no problem. Let's go to the next question. So people experience cardiogenic shock and arrhythmia in which dietary deficiency disease. So is it in peripheral arterial disease or hyperhomocystinemia, Takotsubo cardiomyopathy, or Keeshan's disease? Where do we get it? Where exactly do we get it?
Hint, sir.
Yeah, let's go to the hint, please. So it's an endemic, highly lethal cardiomyopathy first reported in Northeast China.
Option C, Takasubos. Option C, Takasubos cardiomyopathy.
I'm sorry, that is the wrong answer. It is not option C. So shall we pass it on to the audience?
Sir, I guess we can pass the last questions if they don't
Last
answer.
question. Okay, fine. So the correct answer here is option D. So let's go to the next question. When was this declared? So you'll have to listen to the audio clip. Please listen to the audio.
It's therefore with great hope that I declare COVID-19 over as a global health emergency.
So when was this particular announcement done? Was it on 8th May, 10th May, 3rd May, 5th May 2023? When was this announcement done? So your time is running, the clock is ticking.
Hint, sir.
Okay, let's go to the hint, please. The declaration was made by Tedros, the WHO Director General. That is your hint. So I don't think.
10th May 2023.
Okay, so that is the wrong answer, unfortunately. It was on 5th May 2023. Okay, that is when the COVID emergency committee met and the WHO Director General declared the end of public health emergency. Okay, so no problem. Let's move to the next question. Which is the most reliable method of diagnosis of this disease? Is it carbon fusion methods, IGRA, NAA methods, or fluorochrome procedures?
A, carbon fusion method.
I'm sorry, that is the wrong answer. So shall we pass it on to the YouTube audience? This particular question, please. Okay, we'll pass this on. Yeah. So the next, I think you have finished all your questions. So let's over to the moderator, please.
Unfortunately, wouldn't answer any of the questions.
Yes, no problem. So let us go to the next team. Who is the next team, please?
So the audience round, Nishant Ramase has correctly answered the question for the last one, which is the NAAT, NAT technique.
Very good. Very
Yes,
good.
so-
Mr. Dr. Nishant Ramse. Wonderful. Good. Well done. So shall we go on to the next team, please? This is team D. Your choice you have to make. I think number 1, 4, and 6 are already taken. So you'll have to choose between 2, 3, and 5.
5. We choose 5.
So let's go to number 5. 5. Okay, so this is your first question. Identify the disease. Is it polio, letharism, osteomalacia, or genu virus? Your time is running.
Sir, we want a hint, please.
Okay, shall we go to the hint? The symptoms might appear suddenly. Let's go to the hint, please. Please go to the hint slide. The symptoms here might appear suddenly during the monsoon season.
Okay.
Option B, sir.
Very good. Well done. So you get marks for it, some marks, 10 marks. Letharism is the right answer. It's a nutritional public health problem. Let's go to the next question. Identify this personality, and here are your options. Please display the options. So is it James Charles? Is it Ignace Semmelweis, John McLeod, or Joseph Lister? Yes.
Hint, we'll take the hint.
You'll take the hint?
Yes, sir.
Okay, please display it. Display the hint, please. Next slide. So the personality famously discovered the cause of disease among women in 19th century in Vienna. So he discovered a particular
B. Option B.
Option B, Dr. Ignace Semmelweis is very correct. So it is correct. So he was, let's go to the answer slide. So he was the savior of mothers because the incidence of puerperal fever could be drastically reduced by the disinfection. So he was a pioneer of antiseptic procedures, Ignace Semmelweis. So very good. You get 10 marks for that. So next question. Shall we go to the next question? So you have an audio clip here. So shall we play the audio clip? So it's a heart sound basically. You will have to tell us which disease caused it. Play the audio clip. So is it, look at the options now. Please display the options. Is it endocarditis? Is it rheumatic heart disease? Is it arrhythmia, or is it heart failure? So your time has started. 20 seconds time to answer this. What is that heart sound? And where do you see it?
Sir, option B.
Rheumatic.
Option B, rheumatic heart disease. So you've hit the bullseye there. Well done. Correct. Shall we go to the answer slide? Yes, rheumatic heart disease causes mitral stenosis, where there's a loud S1 followed by the opening snap of the mitral valve. So you're absolutely correct. Next question, please. So here we have a couple who is being advised about different contraceptive methods to use post-normal vaginal delivery. They do not want any more children for at least the next 5 years. Which method can the doctor typically recommend for this couple? So you can see these are the options. Is it A, B, C, or D? You will have to clearly tell us. I'm sure you know what these are. So tell us which is that contraceptive, or what method can be recommended.
Sir, we want a hint, please.
Yes. Shall we go to the hint slide? So your hint is it can be used from the postpartum period. Even in the postpartum period, we can use it from the postpartum period.
Option B.
Option B, I'm afraid it is the wrong answer. So shall we send it to YouTube for the audience? I think this is the last question for you guys. So we will transfer this, post it to the YouTube live stream. Okay, fine, no problem. Over to the moderator.
So team D, you have answered 2 questions correctly.
Okay, good. 2 questions correctly. So let's go to the next.
They answered 3 questions.
They answered 3 questions correctly, 2 with hint.
Yes, 2 were direct, 1 was 2 with hint.
One,
right?
yes, 1 was direct,
hint
2
and
with
1
hint.
was direct. 1 was
Yes.
direct, 2 with hint. Yeah.
Yes,
So to
sir.
clarify, you have answered 3 correctly, 1 directly, 2 with hint. So shall we go to the next team?
Okay, Dr. Rubina, you can declare this audience round question answer, I think.
Yes, the answer given by, again, I think Nishant Ramaswamy has again answered it very correctly. It was the liver norgestrol or the Mirena. It was the answer C. So again, he's scoring like it is his second one he has scored it. So I will be taking his email ID. He's allowed to share his email ID to us. Dr. Ria,
Very
can
good.
you share the official email ID?
Yeah,
Okay.
we will share the official email ID after this round ends to the participants who have been answering correctly on YouTube. they can
So
mail
good,
us there.
Dr. Nishant. Well done. Congratulations. So let us go to the next team, Team E. This is your choice that you need to make.
So now, sir, block 2 is left.
Yeah.
So,
Block 2 and anything else is left?
Block 2 and block 3.
Block 2 and block. So please choose among block 2 and block 3.
We'll go for block 3, sir.
Block 3. So shall we go to block 3? This is your first question. You will have to listen to the audio clip. In which acute condition does this sound occur? Shall we listen to see the options now? Is it upper airway infection, acute respiratory distress syndrome, severe pneumonia, or foreign body aspiration? What exactly is it?
We'll wait for the hint, sir.
Okay, let's go to the hint. So these breath sounds have low-pitched crackling sound with prolonged expiration. Where do you see that? Answer immediately. Yes.
So option B, ARDS.
Very good. Well done. You get 10 marks for that. So ARDS have the typical characteristic of low-pitched coarse crackles along with bronchi. So this indicates that excessive fluid is there in the lungs. So let's go to the next question. So identify this famous personality. These are your options.
Anthony Fauci.
One.
Anthony Fauci.
Very good. So you were very rapid indeed in that. So that's Anthony Fauci indeed. Let's go to the answer. So I'm sure all of us have known him. So he is an American immunologist. Of course, he was in the limelight during the COVID pandemic. So he played a big role there. So good. So next question. Whose operation guidelines are traditionally followed for crash cart management under ACLS? Okay. Advanced Cardiac Life Support. And the options are Resuscitation Council of the UK, American Heart Association, Quality Council of India, the NIMHANS, or the International Liaison Committee on Resuscitation. What is your right answer?
So AHA guidelines, option B.
Very good again. So you have answered this quite quickly, of course. So American Heart Association guidelines. Fine. So this is question 4. This is your last chance here. Which one is the logo for the national program renamed on 8th May 2023? Is it A, B, C, or D? There was one national program that was renamed on 8th May 2023.
No, option A.
Option A. Okay, correct. And do you know what the program is?
National Program for Non-Prevention of
NPCDS. Renamed NPCDS to NPNCD, National Program for NCDs. That happened very recently, of course. And the logo is still the same. So well done. Over to the moderators.
Yes. So that was this round. So I'm just stop sharing my screen.
So we will send the marks to the scorekeeper will calculate.
So please hold on for 1 minute. We'll be coming up with the scores.
डायरेक्ट भी जा सकते थे, सेफ नहीं खेलते तो वन पर आ जाते।
आई नो बट माइनस हो जाते तो वो लैथरिज्म वाला हिंट लेके कर दिया ना, और इवान वाला भी हिंट लेके अच्छा किया।
वो सेवन वाइज मेरे को लगा था परी नजर
We have to maintain it.
So are all of you in your department or somewhere else? Looks like all of them are in the office.
Yes, sir. We are in the department, sir.
Okay, nice. I guess we have representation from all the corners of the country. We have a team from one team from Delhi. We have, of course, one team from Chhattisgarh, Raipur, Bhopal, Kolkata, and South India, JIPMER. So that is almost, I think, all parts. Okay, maybe Western part only, nobody has qualified. Fine. So that's a good thing. So just to have some conversation, all of you are which year PGs?
The team A is both of us are second year.
Both of you are second year. Team B?
Sir, I am final year and he is first year.
Okay, very good. So you have a mix there, final year and first year, senior, junior. Nice, very nice. So next team C?
Second year and third year.
Second year and third year. Nice to know. So team D?
Sir, first year and third year.
First year and third year. Again, a mix. Good to see. Team E?
Third year and second year.
Third year and second year. So it's nice to know that you have teamed up. Most of you have teamed up with your either seniors or juniors. So that's nice to know that all of you are inclusive. Very good for our subject specialty, community medicine as well. We need to be as inclusive as possible. And, we should be ready to work with anybody. That is one thing, one tip that I have to give all of you as somebody who's little bit more experienced. That's all. That's good. So what about the scores?
Yes, sir. Almost done. Almost
Okay.
done. Yes, sir. We'll be showing in just a minute.
YouTube पे नहीं
सर हमारा वीडियो कहाँ चला गया सर? No, we will take
तुम बस लैपटॉप अपनी तरफ मत खींचना क्योंकि मैं आउट ऑफ फोकस हो गया तुम
और
So these are the scores now. So in round 2, team A has scored 55, team B has scored 30, team C has scored 20, team D has scored
No,
25.
the team C minus 20, Dr. Teja. They haven't answered. Yeah.
हमने 30 and
Okay.
Teja, the scores are total scores are 10 for team C.
Yes.
It's not 30. Meanwhile, Teja is making some modification. I will announce the scores. Team A for round 2 is 55. Their total score stands for 95. They're leading. Next is team B. Their round 2 scores are 30 and they are at 70. Next team is team E. They have scored very well in round 2, which is 70 they have scored. So their total stands to 70. Next is team D. In round 2, they have scored 35 marks and their total stands for 55. And team C, in round 2, they have scored minus 20 and their score stands for total stands for 10. So team C, you can cope up with the next 2 rounds, so don't worry. And all the best to all the teams. Okay. So Teja will, Dr. Teja will declare the scores shortly on the screen. Okay, so I think everybody is clear with the scores and nobody has any issues. All are good, right?
Points future.
So yeah, so then in the interest of time, since things are clear, we will go to the next round.
Yes.
Yeah. So the next round, you can please share the slides, please.
Yes, sir. I'm
Yeah.
not sharing this slide. So now I hope you can see my screen, everyone.
Yes, ma'am.
Yeah. Okay. So the round 3 is called buzz off round. Okay. So I asked sir to please read the instructions. It is a fairly straightforward round.
So this is a buzzer round. So there will be 10 questions in total. All questions will have multiple choices. I'll have to say answer now. Then your time starts. Time to answer will start. And after reading the question, so there's no time limit here though. The first team to answer in the chat box will be the first response to be taken. Okay, so that's like pressing the buzzer. We'll have to type it in the chat box. You can't change your answer. No change of answer is allowed for the same team. There'll be no rollover questions. In case of wrong reply, there is going to be negative marking. If the team fails to give the correct answer, then I will roll out the question to the YouTube audience, after which I will declare the answer. Okay, so let's go to the next slide.
Sir, what will be the marking?
I'm telling you the marks. Wait, please wait. Next slide, please. Marks are going to be displayed here. So here your time becomes important. So correct answer added, 40 marks if answered in 10 seconds, 30 marks if you answer it between 11 to 20 seconds, 20 marks if you answer between 21 to 30 seconds, and 10 marks if it goes beyond 31 seconds. Okay, and wrong answer. If you answer it wrongly within 10 seconds, you lose 3 marks. If you answer it wrongly between 11 to 20 seconds, you lose 6 marks. If you answer it wrongly between 21 to 30 seconds, you lose 9 marks. And if the wrong answer is given beyond 31 seconds, you will be losing 10 marks over there. Okay, I hope it is clear.
So the
some
buzzer
is not there. You will have to type in the chat box.
So the answer should be said.
No, the answer should be written in the chat box.
It should be typed in the chat box, no verbal communication.
A, B, C, or D, you just write in the chat box.
You will have to type whether it is A, B, C, or D. Don't have to type everything. Just A, B, the option alphabet. Okay.
Just be very like the teams the first team who will be answering correctly, their correct answer marking will be done. Okay. And if if you are answering wrongly in these times, then the negative marking will be there for any team. So just be cautious of answering wrongly. Okay. So that is the I hope the rules are clear.
See, if everybody mark wrong answers, each and every team will lose marks.
But if multiple people are answering same like correct answer, then
the one who answered first will be taken into consideration. So it's always first come first.
Then the second person won't get negative marks, no?
The organizers, please clarify that.
No, once the correct answer is there will be no negative marking. But before that, if anyone says wrongly, they will be having negative marking.
Ma'am, then I have a doubt. Like, I answer the first option, and then that is wrong. But after me, other team can answer, and if they answer correctly, their point will be added.
Yes.
Yes. Okay. So suppose I'm giving you another example here. You can just clarify my doubt, Dr. Ria. So suppose now we see that team A has answered wrongly, team B has answered correctly.
Yes,
okay.
Sir.
So team B gets the marks.
Yes,
team
sir.
C also, if they answer correctly, they don't get the marks.
No, sir.
Right? Because team B has answered before them.
Yes, sir. It's just like the buzzer. Whoever presses the buzzer and answers.
Clear with it. But multiple wrong answers, wrong mark you will get. Suppose see team A has answered wrong first. Okay, team B has also answered wrong, but they have answered after team A. Do they also lose the marks?
Yes, sir. Anyone who the first
anybody who answers wrong. So please be
before the
very
correct answer
mindful
is
of
there.
this. Anybody who gives the wrong answer will lose marks. But correct answer, we will be rewarding the person who's the first person giving the correct answer. First team giving the correct answer. So I hope we have given examples here to make it clear for you. So let us go to the questions now.
Yes, sir. So question 1.
Question 1 is here. So community-oriented primary care can identify and address major health problems in their adopted community. Which of the following is not one of the activities towards this process? The options are A, definition and characterization of the community. Option B, identification of the community's health problems. Option C, building a new healthcare system in response to the community health needs. Option D, monitoring the impact of the system. So answer now.
Definition and characteristics of the community.
So we have seen some responses in the chat box. So who has responded first?
Monitoring the impact system.
So team D has responded. Team E has responded.
So we are at the 40-second time. Now we will see the answer.
Now let's have a look at the answer. Next slide. So the answer is option C, and team D has answered it first.
Yes, sir. The team D has answered first correctly and within 10-second time frame.
Within 10 seconds.
Yes.
So let's go to the next question.
Yes, sir.
This is question 2. Chronic diseases can be treated under which type of innovative primary care models? The options are: is it direct primary care? Is it comprehensive primary care? Is it focused model? Is it care enablement model? So answer now. So please wait for me to say answer now. Anyways, one person has answered.
undo नहीं कर सकते ना.
The time up.
Yes, sir. 10
Yes.
seconds left. 10 seconds if anyone wants to answer. Okay. So
Right. So
time
let's
up.
have a look at the right answer
So
now.
yeah, no one answered correctly. So that's the correct answer is
Both the teams, that is team E and team D, both will get the negative mark. Correct answer is C, which is comprehensive focused model. Okay.
yes, sir.
Fine. So both the teams get negative marks. Shall we go on to the next question, please?
Sir,
Yes,
sorry,
sir.
I would like to ask the moderator, like, what is the time of
Yeah.
team E?
So after each question is answered, you can please tell us the time also.
Okay. So basically the team
E
E
and D.
E and D, they have answered within 10 seconds, and team D, E and D, and then team A answered after 10 seconds. That is within 20 seconds they have answered.
Okay. Thank you.
सब गलत. A कहाँ है?
Okay. So
Okay.
now we are going to the next question, sir.
Next question. This is the question for you. Which among the following services did the World Health Assembly 72 at San Francisco not highlight under the primary care? These are your options. Is it role of community health workers, rehabilitation services, health, environment and climate change, outbreak management? So answer the question now.
मैंने देखा नहीं.
Two teams have already answered.
Yes.
मैंने same time पे
Anyone else?
Anyone else interested for this?
थोड़ा सा लेट हो गया फिर अगर सही है.
Okay, so we are stopping the time. We'll see the answer, sir.
Yes.
The answer
So
is
it is the outbreak management. So it's the wrong answer.
ये की थी ना आंसर.
Okay, so
okay, sir.
this
They,
was on.
the teams E and D have answered like within 10 seconds.
Yeah, they have answered wrongly within 10 seconds. Okay, no problem. So you're taking risk. It's nice to take risks. Next. Question 4. While administering the anti-snake venom, how should the starting dose be prepared? And the options are: A, dissolve 10 vials in 100 ml distilled water, then add to 400 ml normal saline for infusion. B, dissolve 6 vials in 100 ml of distilled water, then add to 400 ml normal saline.
No.
Option C, dissolve 6 vials in 100 ml normal saline, then add to 400 ml distilled water for infusion. Option D, dissolve 10 vials in 100 ml normal saline, then add to 400 ml of distilled water for infusion.
Okay.
Okay. Sir, the team E has already responded.
Yes.
Team E has already responded A. So that is the correct answer. So we
So
will show.
that's the right answer. Congratulations.
So team A has answered within 10 seconds.
So very good. So dissolving 10 vials in 100 ml distilled water, then add to 400 ml normal saline. So that is the correct answer here. Good. Well done.
Okay,
Next
so-
question.
Yes, sir.
So what is the recommended energy density of complementary feed? The options are 0.5 to 0.7 kilocalories per gram, 0.6 to 0.8 kilocalories per gram, 0.7 to 0.9 kilocalories per gram, 0.8 to 1 kilocalories per gram. Looks like a lot of them are taking chances. I could see that 2 or 3 teams have already responded. But
Yes,
remember,
sir.
you
And,
can't change your answer.
Yes, sir. And team D has already answered correctly.
Yes, so
Within
team D
10
has
seconds.
already given the correct answer to us.
Yes, so it
Well
is.
done. So it is 0.8 to 1 kilocalories per kg.
In that case,
That
team
is
E
the correct.
answered, right?
But team D answered twice, no?
Team D answered twice, D and B.
But
Sir, but
it is the
that
first
is
answer
no,
that
no,
is
no.
taken into consideration.
No. The
D
team
answered
D.
twice.
No. Wait. Team D had answered D for the for the fourth question, and then B for the fifth question.
In that case, team E answered the right answer.
Team
Also,
E answered.
for
Yes,
this
yes.
question only, ma'am.
Team
No,
E
no.
answered. Just to clarify, it is Team E. E
Yes.
for elephant that has answered correctly.
Yes. Team
Okay.
D
Sir, he
had
answered
answered.
this question
Team
only,
D.
sir.
Sir, to clarify here,
No.
the team D has answered the previous question,
Yes.
In D.
which
Yes.
was D. This
And
one,
then B. They answered
this
B.
question they have answered as B.
Yes, sir.
So team E is correct.
Yes.
Yes.
And team B is correct. And
Next
Okay.
question.
Question 6.
This is question 6. You can see the question here. So the question is the RO, basic reproduction number of measles is. It's a recall based question. Is it 1.5 to 4.5, 12 to 18, 2 to 4,
Yes. So
1.4
team.
to 1.6?
So team E has answered, sir.
So
Correctly.
already good. So the answer is 12 to 18. So they have answered within 10 seconds, I believe.
Yes, sir.
So good. They have taken another chance and it has turned out to be right. Let's go to the next question. Question 7. So you are a medical officer in charge of PHC. What is the least important out of the following that you will prioritize during COVID-19 outbreak? Is it COVID case finding and referral? Is it PHC facility preparedness for COVID-19?
their options are not visible.
Yeah, see the options are there with you now. C, leverage support for managing social disruptions due to COVID-19, or continuity of essential non-COVID-19 services.
Yes. So I think answer is in. Team E has answered. Team E has wrongly answered D, and Team D has rightly answered C.
So we got the correct answer from Team D, who have answered as C. Let's go to the next slide.
Yes, sir.
However, Team E has given the wrong answer within 10 seconds, I suppose.
Yes, sir. So
Yes.
Team D, basically Team D gets the marks. And,
and they have answered within 10 seconds.
Yes.
Sir, team C has also correctly answered, but we will not get marks, right?
No, because the one who has answered first come
But
first.
we won't get negative marks, though.
You won't get.
No. Once the correct answer is there, the negative after that, if a wrong answer is coming, then no negative mark. Before that, if a wrong answer is coming, then.
I request all the teams send the message as everyone instead of like to the particular person.
Don't do that. Yeah. It should be
Sir,
sent.
that is happening actually because team C is directly sending to me and team E is sending to Ria ma'am.
Correct.
Yeah. So please just
Don't do that.
correct it. Correct
So you
it
have
first.
to send it
all
to
the
everyone.
all the teams I request when you are answering there you can see two that you should keep it to everyone in the meeting so that others also can see the what you are answering.
It is on public. Okay.
Yes.
Fine. Yeah. Next.
Thank you, sir.
Thank you. Next.
So this is the C
This
is
is
the
the
answer.
answer. So leveraging for support for managing social disruptions. So this includes case finding, referral, and PHC facility preparedness. So
Yes,
it was
sir.
very essential. Yes, next. So this is question 8. Which will be the most accurate method to estimate gestational age if a pregnant woman with 9 weeks period of gestation is unsure of her first day of last menstrual period? Question 8. So these are the options. Using her LMP if her uterine size is consistent. A first trimester ultrasound, second trimester ultrasound, serum HCG level.
B होता है B ये तो लिखते कि B बोल दिया हमने.
Okay. Who has answered first?
Sir, firstly, team A has answered, and that is right.
That is correct. So
That
team
is
A was
correct.
first. Many other teams also answered correctly. Next, go to the next slide.
Yes.
So option B, which is next slide, please. First trimester ultrasound. That is the most accurate method to establish or confirm the gestation age.
Yes, sir.
Okay. So team A gets the marks. They have answered within 10 seconds. Well done. Next. Team question 9. Changing of the AHA, American Hypertension Association diagnostic guidelines for hypertension in 2017 was based on which famous trial? The options are: was it Framingham Heart Study, Sprint trial, Access trial, Swift direct trial? So any more answers? Okay, so we have got the right answer, I think.
Yes, sir. Team C.
Team C has answered correctly.
Team
Right?
C has answered, yes. First attempt, Team C has answered
Yeah,
correctly
so
within 10 seconds.
there were other teams that gave negative answer, right?
1, 2, 3.
What is the correct answer, ma'am?
Yeah.
The correct answer
is B. Wait.
Sprint trial.
Yes.
So there are team D. Team D, no.
Yes, sir, I'll tell.
Yeah,
Sir.
tell. Please tell.
Team A, Team E, then Team D. The A, D, E have answered wrongly in the first 10 seconds, and Team C has answered correctly. So
Very
D,
good.
E, A have answered wrongly.
Good. So Framingham Heart Study was done long back. Sprint trial was the latest one, which was based on a systematic review of 10 studies. Okay, so that guideline was next. Last question in this round, I believe.
Yes,
so an
sir.
ad hoc committee on education for family practice was appointed by the AMA Council on Medical Education to study family medicine training and stated that the American public does want and need large number of qualified family physicians. What is this committee called as? What is the name of the committee? And the options are as follows: Folsom Committee, Flexner Committee, Willard Committee, Mills Committee.
Team D has answered, Team C has answered, Team E has answered. 2 more teams left.
Yes. Shall we close it?
Yes, sir. Just 5 more seconds, I think. Then we can close it. Yes, sir. Now we can close it. So
we've closed it.
Yes, sir. So none of the teams have answered correctly. And team B and D, they have answered within 10 seconds. And then team E answered in between 11 to 20 seconds. So a team B and D get -3 and E get -6.
And what is the answer, ma'am?
So
The answer is Willard Committee. That was the name of that committee. Okay. Fine.
Okay.
Issues. So
okay, sir. So I'll stop sharing the screen, sir, and we'll calculate the scores in 3 minutes, and then
so we'll get back to you after the scores are calculated.
Yes, sir. Okay.
Thank you. So good competition. It was nice, rapid answering by most of the teams. Some of them worked out, some of them didn't work out, but no problem. All of you have taken a chance.
एक तो उसमें से BOT confusion वाला था ना, उसके अलावा 2 है।
उसके अलावा 2 है।
Would be now. We cannot. No.
There is a break. Can we get away from the camera for a while?
Can we finish?
Hello, ma'am.
Yes, you can, but do not turn off your camera or audio.
Yeah, just 2 minutes.
2 minute break. अरे घोड़े जानो ना ढोकी It's fine. We are okay with that.
रेसिपी कैंसिल हो गया सर हम कौन से रैंक पे हैं
माइनस इतना लॉस नहीं है ये नहीं था
सो के नहीं कितने माइनस में गए 8
12
बस 12 मार्क्स आंसर ही नहीं किया क्या
तो 40 करेक्ट का होगा नहीं 40 मार्क्स तो
Ashish has the division to third person cannot come in.
So the scores have been calculated. I am sharing with our scorekeepers and other moderators the score, and he can then share on the screen.
There are so many people typing this, that, confusing rules there.
আমি কিন্তু খাবো না রেকর্ড দিতে পারবো তুই নিয়ে নিবি
Someone is calling you.
এটা লাস্ট রাউন্ডের সামনে খাস না একটু হয়ে গেলে খেয়ে নিবি খেয়ে নিস
कि वो लेडी कर रहा था है ना।
ये
भी
तो बाद
हमारे
में
साथ
5 बजे हमने 5th क्वेश्चन के बाद ये वाले जागे, पहले सो रहे थे।
पहले से कौन जा रहा था, हम लोग लोग उनको पर्सनली भेजे सर, हो सकता है वहाँ पे कुछ सही
नहीं
निकला।
तो फिर गलत और सही तो यही बता रहे थे ना, वो was answered was not answered पहले, क्योंकि पहले में ये लोग आंसर कर ही नहीं पा रहे थे, लोग अपने से बातें कर रहे थे, इसलिए उनका नहीं बोल रहे थे।
So participants, we have only one round left. Okay. So now the scores will be declared for this third round, and again those scores will be considered for the teams to answer in the fourth round. Okay. So the scores that you have that is shortly to be declared will be the determinant of the same thing in round 4. So Dr. Teja, please show the scores.
अब बात करने से हम दिखेंगे।
अच्छा ऐसा?
मैंने ऐसे सेटिंग कर रखा है। बात करो।
Yes.
What?
Sir, can you please read the scores, sir?
392, 61.
So yeah. So round 3 में team A scored 71. Team B
Sir, we
have got
didn't answer anything, like any question, so -9.
Wrongly answer किया होगा।
Answer team E we
please,
answered.
See, please be mindful. If
didn't-
you answered wrong, you would have got -3.
No, sir. No, sir. Actually, we didn't answer the questions. Then negative case, like we didn't answer actually all these questions.
Yeah, the team B has answered actually within before the correct answer was declared. So that's why
No,
the
sir.
negative.
No, ma'am. We didn't answer actually. We didn't answer any questions before the right answer. Can you please check once again?
Yes.
And ma'am, team E we answered 3 questions within 10 seconds. Correctly.
Yes, team E, na?
Yes.
No, ma'am. Team B.
Team B.
Team B.
हमने 4 किया।
No. You answered, but your answer was given by someone else first.
No,
Ma'am. We did, ma'am. From my part, I'm trying to tell you, like we didn't answer any questions at all. So how can we come like negative? Can you please check once, because we didn't answer the questions at all.
Okay, we will check into this course later, and we can carry on with the fourth round.
1 second, but then team E score is like completely wrong. Like we have answered 3 questions correctly first within 10 seconds. So we have at least like 120 there in round 3. Team 3 drastically there is some gross error.
No, we will check. We will check with it. We will continue with our fourth round. Then we will announce it at the last round. Okay?
Sure.
Do not worry.
The Quizmaster also told, just for information.
Okay. So we can continue with our fourth round till we check our third round. Okay? So do not worry.
Team E actually answered question 7 and question 10 as wrong. Basically, we
have answered wrong. We have answered 3 questions rightly within 10 seconds. First.
Exactly, but you had negative marking also, right? Iske liye you got 92 out of it.
92.
The negative marking is like -3. positive marking is 40. 40 into 3, 120. So from 120, you have to subtract a negative. If it's in first 10 seconds.
You have answered only 2 questions rightly.
No, 3 questions rightly. Quizmaster also said it. Confirmed.
And if you have answered it, we will check it whether you have answered it before time or after the time was said. Okay. We will check through it. We will go for our final round. Then we will be knowing, because I can see only 2 answers you have.
Okay. One correction I'd like to make right now is team B don't have any negative marking. There is 0. Rest I have just checked. It's fine. Team B doesn't have any negative mark, so it's 0. And rest have been verified again. Okay. So Dr. Teja, please note down the changes. We'll move on to the 4th round. Yeah. Okay.
Round even if you have said 2 questions right also, that will be like 80. 80 minus how it drastically became 22.
You have answered 2 questions, right?
No, we have answered 3 questions rightly. 3 questions.
So we hold on.
No.
All the answers have
Team,
been
in the 9th question,
all the
team B
answers
answered
have
before.
been recorded over here, right, in the chat box. So we will go through the chat box. It will be visible. There can't be any mistake in this round. Okay, so do not worry about your scores. If you have answered 3 questions rightly, you will get accordingly. So we will move on to our next round. Till then, we will be me and my team will be checking. Okay, so do not worry, because everything is visible. We will not manipulate any scores, right? Okay.
Yes. Okay, so I'll start the share the screen for team round 4. So I think we can start.
Yes.
Yes.
We'll start. Yeah.
Okay. So from the scores, sir, please read the instructions of the Rapido round. Sir.
Here, these are the instructions. You will have 6 topics to choose from. Each team will select 1 topic with 4 questions each. Team scoring highest in the 3rd round will get to choose a topic first. So time allotted for each topic or team is 150 seconds. There will be no multiple choices given. The first response will be taken for each question. So there's no MCQ here. And the participant can skip to the next question by also saying pass. Okay. They can round back to the unanswered question if time is remaining. Okay, so you have 6 topics. You'll have to select 1 topic. Okay, each team will have 150 seconds. So it depends on how many questions you answer within your time frame. There will not be any multiple choice questions or options given. Okay, and you can even skip to the next question in the interest of time by saying pass. So there won't be any rollover or passing to other teams. In case of wrong reply, you will have a negative mark. How much I will tell you. If the team cannot answer the question, then we will direct it to the YouTube audience. Okay, and the correct answer will get 50. Wrong answer is going to be a deduction of 25. If you pass, you don't lose any marks. It stays as it is. So 50 and 25 is what you need to remember. So over to the moderator. So
yes,
which
sir.
to choose?
Team D has the highest.
Team D, you will have to choose now. Choose one of these areas. What do you want? Whichever you are comfortable in. Please be fast in selecting one. You will have to choose fast.
Please choose.
Choose fast, or else you will lose the chance to choose.
3, sir.
3. Okay, let's go to family medicine in primary health care.
Okay, sir. So I'm showing the question. We have I think you have 150 seconds. Okay, so 2 minutes 30 seconds to answer the 4 questions. So I'll display a timer on my screen. So the timer will be ticking down. Within that, you will have to answer the 4 questions, rightly or wrongly. Yes, sir. So I'll just share the timer. Just a minute.
So remember, 50 correct answer, 25 negative. 25 marks get detected.
Yes, sir. So I'm just sharing the timer. And shall we start, sir?
Yes, I'm ready. We'll start.
Okay.
So this is your question. First question, US Preventive Services Task Force recommended adolescent screening of major depression disorders from which age group? If you're not able to answer, you can even pass the question. Your time is ticking.
Shall you move on to the next question? Would you want to pass?
Can we pass and come back again on this?
Yes, sir. Yes. Within the
Yes.
time limit, you can.
So next question. What is full form of ICOPE?
Next question, sir.
Next question. This question 3. The AAP 2016 recommends that for the first 6 to 12 months, infants should sleep in the parents' room, but not in the parents' bed to prevent which condition?
Baby के पास जाती है mother.
Next question, sir.
Next question. Please pass. To consider metformin for patients at higher risk for developing diabetes. Okay, those who have a BMI of 35 kg, or those who age 60 years or above or younger. Which year of ADA guidelines? What is the
Next question, sir.
year? Yeah, you have finished your 4 questions.
45 seconds left. You can
You
answer.
can answer, or it's up to you. 50 for the right answer, 25 for deducted for wrong answer.
ये बता दीजिए ना.
Team D, 20 seconds left. Time is running out.
कंडीशन का नाम थोड़ी पता है. फैमिली मेडिसिन को कराना हो भाई यूएस के दे दिया. इंडियन को
Okay, so time is up.
Time is up. So let's have a look at the. Shall we have a look at the answers?
Yes, sir.
Yeah. So these are the answers. For the first question, the answer was 12 to 18 years. Okay. Second question, the answer, the full form of IACOPE was integrated care for older people. Third question, so it's a condition called sudden infant death syndrome to prevent that. Fourth question, the guidelines, the American Diabetes Association guidelines for this particular option was formed in 2020. Okay.
Yes,
so
sir.
you do not get any marks, neither do you lose any marks.
Okay.
So your marks is as it is. Yeah. Next.
Yes, sir. The next team is Team A. Team A. So we'll go to Team A. Anything other than 3. Please choose.
Miscellaneous.
Okay. So number 5, miscellaneous.
Okay.
These are your 4 questions. First question.
I'm starting the timer.
Yeah, timer. Your time starts now. So what is the preferred drug of choice for iron deficiency in India after 13th week of pregnancy?
IAP tablet.
Yes, can you answer?
IAP tablet. Iron folic acid.
Okay.
Like in
Okay.
Go to the Go to the second question. Let's have a look at right or wrong later. So your answer.
Anandi Bai.
Okay, let's have a look at the third question. Under Poshan Abhiyan, the specific target of the National Nutrition Mission is to decrease dash percentage of anemia per annum.
3%.
3%. Or next, let's have a look at the fourth question. What is the cutoff for acceptable weight loss in the first 7 days of life?
10%.
10%. So let's have a look at the answers. Let's see how many you have got correct.
Yes, sir.
For the first question, you said IFA tablets, right? But the correct answer is IV iron. So you lose 25 marks for that. Okay. Second question, you have answered correctly. You said Anandi Bai. The full name is Anandi Bai, Dr. Anandi Bai Joshi, but I'll still give it to you 50 marks plus for that. Third question, you answered it correctly. You said 3%. So we'll give it to you. Again, another 50 marks added to that.
Yes.
Fourth question, you have answered it correctly again. Well done. So it is 10% is the acceptable weight loss. So you have answered 3 correctly and 1 wrongly.
Yes, sir. We move on to the next team then.
Next team.
Next team is, according to the scores, it's team C. It's team C for now. Anything apart from...
no, ma'am, we'll be last. We are last. We are not...
No, not on the total score. It is based on the score of the third round. Okay. So now team C will attempt the question, attempt the topic other than 3 and 5.
Number 2.
Number 2. So let's go to community medicine and primary care.
Okay, just a minute. Number 2, right? Yeah. And so number 2.
This is your first question.
I'll start the timer.
Please start the timer. Yes, the first question, which forms do the health workers fill under the IDSP? Under the IDSP.
We can come to the answers later on, sir, also.
Yes.
So
but
please.
You need to tell us. So we'll proceed forward. Next. According to guidelines under Rashtriya Bal Swasthya Suraksha Karyakram, what is the maximum time for filling the RBSKY checklist to an administrator?
Okay, the next question.
This type of inventory technique is based on demand variability. What is the inventory technique called? Inventory technique. Next
question.
Next question.
You want to go for the next one? Okay. Under which ministry does the program implementation wing come?
So, sir, last question is not visible. Which ministry does the program?
It is visible. It is visible to us. Under which ministry does the program implementation wing come? It is visible. It's clearly visible. The screen is visible to me.
Then answer of number 1 will be like form A, B, C.
Okay, you have answered that. Okay, I will take it. We'll see later whether it's correct or not. What about the other answers? So you answered form A, B, C for that. So I'll take it. I'll lock that answer. Next.
45 seconds left.
Any other?
And to answer number 4, family Ministry of Family and Ministry of Health and Family Welfare.
MOHFW, Ministry of Health and Family Welfare. Okay, I will take that as your answer. Anything else?
15 seconds left. Time is up.
So time is up. Let's have a look at the answers now. So the first question answer is nothing but S form for the health workers in IDSP. You said ABC form, so you lose marks for that, 25 marks. Next, according to guidelines under RBSK, what is the time? 45 minutes. You didn't attempt it, so you will not get any marks, neither you lose anything. The third question is something called XYZ technique. It's a very important inventory technique, which is based on the demand and supply, demand variability. You learn it later in health economics. Under which ministry does the program implementation wing come? You said MOHFW, no, it is not MHFW, it is Ministry of Statistics and Program Implementation. So unfortunately, you've got two wrong answers. Okay, so two wrong answers and nothing else you attempted. You didn't attempt two answers, so two wrong answers. So you lose 25
S
marks.
form you said we'll get half marks, na? So number
You said
one.
ABC form, you said.
Okay, but you said
You will not
get
get marks. No, no. ABC form is different. I didn't say I will get half marks.
Okay.
I said you will lose marks. Okay. There's nothing called half marks here. Fine. So let's go to the next one.
Now the team E. Team E will have the chance. Team E can choose except for 3, 5, and 2. So they can choose 1, 4, and 6 among 1, 4, and 6.
We'll go with public health updates.
6.
Okay, number 6.
Okay.
Let's go to number 6.
So I'm turning on the timer.
Yes, so this is your first question. WHO recently released a public report for the kit performance evaluation of an assay to detect IgM to yellow fever virus in the context of which surveillance?
Pass.
Okay, let's go to the next question. It's passed. What is the health problem related to Greater Horn of Africa crisis? Africa, Greater Horn of Africa.
Pass.
Let's go to the next question. What is the Vision 2035 of India in a book that was published by Niti Aayog and University of Manitoba?
Pass.
Next question, the last one. For how many years will the rollout of the first malaria vaccine called RTS-AS01, a vaccine that acts against Plasmodium falciparum, the deadliest malaria parasite globally and the most prevalent in Africa, take place? How many years is it scheduled? From which year to which year? Or the number of years?
One minute left. Thirty seconds left.
Is question 3 public health?
Which one? What do you want to answer? Please be clear. I could hear a murmur, but I cannot take that as your answer.
5 seconds. Okay, so the time is up, sir.
Yes, so I didn't hear any answer.
Yes,
they
sir.
have not confirmed any answer. So let's have a look at the correct answers. First one is something called YF MAC HD 1SA. Okay, so that's a kit for performance evaluation to detect IgM in yellow fever virus. Second question, it's nothing but food insecurity or even malnutrition, because Africa is unfortunately known for that. What is Vision 2035? So that was on public health surveillance in India. Okay, so for how many years will this particular vaccine be rolled out? So that was 3 years period. If you had told 3 years or so told 2022 to 2025, I would have taken it. Okay, anyway, so you have not answered anything. So your scores stay as it is. You have not attempted any question.
So finally, it's team B. Team B, they can choose between topic 1 and topic 4. These two.
Sir, national health programs is one.
National.
Okay, let's go to 1.
Yes, sir. So I'll start the timer.
Yes. This is your first question. When was the IPHS standards, which make standardized rules for setting up of primary health centers, first introduced in India? Which year was it introduced?
So 2007.
2007. Okay, let's go to the next question. We'll see whether it's right or wrong later. When did the first discussion of Health and Wellness Center of India take place? Health and Wellness Centers.
So discussion or when it launched?
When was it? When was the first discussion taken place? Not when it was launched. When was it first discussed by our policymakers?
So 2017.
2017. So I will take that as the answer. We'll see later if it's right or wrong. Next question, please. Which declaration in 2018 endorsed emphasizing the critical role of primary healthcare around the world? What was that declaration?
So next question.
Next question. Under the ambit of which program Mera Aspatal initiative was established? My Hospital initiative.
Sir Suman.
Suman. Okay, so I'll take that as the answer. So let us go to the next slide.
Question 3, do you want to answer?
Yeah, sorry about that. Question 3, do you want to attempt? Your time is still running.
Sir, let us have a look.
Okay.
Sorry?
You have 1 minute.
Let us have a look, sir. One second.
Yeah, please. You have time. I'm sorry about that.
Sir, Astana Declaration.
Astana Declaration. Okay, fine. Let us see the answers now.
So I'll stop the timer and we will go to the answers.
So they have attempted all 4 questions.
Yes.
Let us see the answers now. So the first answer is absolutely correct. So you will get 50 marks plus for that, 2007. Second question. So it was wrong. What did you answer? You answered as, I think,
2017.
2017, which is wrong. So you deduct 25 marks for that. Third question, you have answered it correctly. So it is Astana Declaration. You get plus 50 added for that. Fourth, I think, what did you answer?
Suman.
You have answered as Suman, which is wrong. It is National Quality Assurance Program. So you get 2 correct. So 2 answers you have answered correctly. 2 answers you have answered wrongly.
Yes.
Okay.
So, sir, just here only I'll declare the scores for
this round.
Yeah, for this round I'll declare the scores. Any team can correct me if I say it wrongly. I'll just stop sharing the screen. Okay, the first team D had not answered anything, so they scored 0. Right? Team A answered 3 correctly, 1 incorrectly, so they get 50 into 3 minus 25. That is 125.
125.
Okay. Team C has answered 2 incorrectly and 2 didn't answer. 2 questions you didn't answer. So it's minus 50. Team C. Team E has not answered anything. So 0. And team B, 2 correct, 2 incorrect. So 100 minus 50, 50. Okay. Scores are fine.
Good.
So now we will take a break and we will calculate the final, we'll display the final score and also look into the round 3 confusion that happened. So please give us some 5 minutes time. The scores are almost done. We'll just look into round 3.
Thank you.
Sir, can we mute now?
Yes, you can mute.
Yes, please.
Yes.
I mean, ideally, we should have
So we are having plus 50.
Plus 50 plus 5.
1 second. Let them put it.
Confused, ma'am.
Ma'am, ours is 125, team A.
Team B is having plus 50, ma'am.
Yeah, yes, ma'am. Thank you.
Ma'am, team B is having plus 50 for this round.
Ma'am, team D 0, ma'am.
Hear me, everyone? Yeah, team B is plus 50, team C is minus 50, team D is 0, team E is 0.
Yes,
Yeah.
ma'am.
Okay, now it's correct. So, round 3 has also been finalized. Round 3, Dr. Teja, you can put in the round 3 slide if you can.
Negative 6, 3, 18 marks reduction. At least we'll have rent correct 80 minus 18. We'll have 62 marks, 22, 70 plus 62. 130 plus 130.
So meanwhile, let's have some questions for the audience. So Dr. Teja, can you please stop sharing this? So audience, can you identify this personality? These are the options. It's open question for all the audience. So I want you to box and we'll be giving prizes for the correct answer. So there is 30 seconds. Please, options are already been displayed. Is it James Lind, Gerard Hansen, Gay Fedget, or John Atkins? Just go to the answer. So the personality was Gerard Hansen. And the person who is remembered for his identification for the bacterium Microbacterium leprae in 1873 and as a causative agent for leprosy, which is a chronic infectious disease which affects the skin, the peripheral nerves, mucosa of the upper respiratory tract, and the eyes. So, can we go to the next question? I hope somebody has already typed in the chat box and we'll look into it and we'll announce the winners. So, this is the next question. So, pregnant woman during her ANC visit in 8th month of period of gestation had the CBC result. She has been taking iron folic acid regularly, but has nausea and indigestion. So, what could be the treatment of choice? So, the options, if it is blood transfusion, or ferrous ascorbate, or parenteral therapy. 30 seconds for it. So everybody can type in the chat box. Here the answer is parenteral iron therapy. Hemoglobin level is between 7 and 9, moderate anemia, fovage, and but third with severe symptoms. This is an indication for parenteral iron therapy during pregnancy. This was a question. Let's go into the next question. A 5-month-old infant presented to your PHC with a complaint of sudden crying at 15 minutes interval, and the stool was spotted with blood, and the baby's abdomen is very distended. What could be the provisional diagnosis in this case? So here you can see an X-ray also. So the options, it could be the intussusception, milk allergy, acute gastroenteritis, or incarcerated hernia. Time starts now. So let's see the answer. Yes, it's clear it is intussusception. Here a segment of intestine invaginates into the adjoining lumen, causing bowel obstruction. And the main symptom of intussusception is severe crampy abdominal pain that would be lasting for 10 to 15 minutes with alternating with the periods of no pain. And stool becomes filled with mucus as well as blood. So thank you. So we'll go back to the final scores and hope the scores are ready.
We are doing it.
Okay, so the slides are visible. Sir, you may again reiterate if you can, or.
So yeah, thank you, Dr. Ria. So this is the round one score. So team A had scored 40, team B had scored 40, team C had scored 30, team D had scored 20, and team E 0. So this was in round one. Next. Next, please. So this was in round two. In round two, team A got 55, team B 30, team C got -20, team D got 35, team E got 70. And at the end of round, the scores were team A 95, team B 70, team C 10, team D 55, and team E 70. Let's go to the next slide, please. So this was round three. Round three, team A scored 31, team B 0, team C 34, team D 102, team E 62. And the total scores at the end of round three were team A 126, team B 70, team C 44, team D 157, team E 132. Next slide. So round four slide. Round four scores. So team A scored 125, team B scored 50, team C lost 50 marks there, team D 0, and team E again 0. So the total scores are team A 251, team B 120, team C -6, team D 157, team E 132. So first place team goes to team A, second place goes to team D, third place goes to team E. So I would like to congratulate all the teams. Please don't worry about the scores. It's the process that's important. And all of you have done well. All of you are winners in your own regard, your own way. So because reaching this stage itself is a big achievement. So all of you please cheer up. And I thank you all for a very active participation. And at the same time, I would like to thank the entire team behind this. The entire team. So I was just like a narrator, but we had a wonderful team starting from Dr. Rubina, Dr. Ria, Dr. Haripriya, Dr. Teja. Kindly pardon if I've missed out anybody. So all of you have done a wonderful job behind the scenes, preparing these questions, preparing the PowerPoint, deciding many things. So it was a very complex quiz, right? So it's always a challenge to organize such things virtually. Face to face is easier, but doing it virtually in a Zoom platform, all of us are medicos. We are not tech savvy or experts in technology, right? So doing that, creating breakout rooms, having all these innovations. So it was a Herculean task, and all of them, the entire team has done a wonderful job. So a big round of applause to them and to all the participants as well. So that's all from my side. Thank you, and over to the organizers.
Thank you so much, sir, for these kind words of. We are very much grateful that you became a part of this quiz. And right now, I'll like to congratulate all the teams who have participated in the finals. Like all of you are really winners. And thank you for keeping some valuable time for this quiz. And now that we are almost done, I'll ask the other moderators and Dr. Rubina also if anything is left to announce or say. And yes, we will display our the email in our sharing screen. So I'll just display the email, and the participants who had been on YouTube and were answering, they can just message us at the email and let us know. So I'll just share the email on the screen. And till then, Dr. Rubina or Dr. Haripriya, if you want to say anything.
Yeah. Thank you, Dr. Ria. So congratulations to all the teams, and thank you so much to our quizmaster for being with us, and he was always there for the entire process for guiding us. And since as sir said, this was our initial startup to do a national level quiz competition in an online mode. So hopefully we have conducted it quite well. And thank you for the participation, because in the initial round, we had so many participants, and that too full-on participation from most of the colleges. So thank you so much. And again, we are very much thankful for all of our 5 teams, and we have done so well. And thank you so much. And I would like to hand it over to Dr. Rubina. Dr. Rubina?
Yes, thank you, Dr. Haripriya. I'll just share my screen. Yeah, so congratulations, Team A, Team D, and Team E. Please, a very round of applause to the teams. All the teams have participated very nicely, and yes, there were some glitch in our technical side also. Very good, very well played, especially Team D. The game changer round was their third round. It changed them to it made them into the first runner-up team, so it was a very good play by Team D on third round. So I would like some suggestions and some feedbacks from you guys, if you can give us. And thank you, Pracheth sir. He has been a very big support and very big help, and he accepted our request to be the quiz master for this national quiz. We have conducted it for the first time, And yes, the technical, whatever the glitch were there, in our next, whenever we will be holding our national quiz for the next time, we will take a note of it. And but yes, it is an interactive session. So yes, all the teams are requested to interact. So we'll start with team A, or we should start with team E. Okay, so we'll start with team A, the winner team.
Ma'am, thank you for the opportunity, ma'am. It was a really nice platform. The competition was like up to the mark. We could feel the tension in there. It was really good. And the questions were really clinical based, mostly practical, which we would face on a daily life. Ma'am, like we have like 2 suggestions. Ma'am, first in round 1, we felt that like in a tense situation, we were reading the questions and then came the options. So a small suggestion, if the question was also displayed side by side to the option, we could like relate and answer. I just felt a gap.
Clinical based, it was the case scenario based.
Yes, ma'am. So the case scenario was so lengthy. We had so many points to remember. And then with the 4 options, we could have excluded if the case scenario was displayed side by side. So
okay, we will keep a note about it. We will be in our future quiz competitions. If it is held offline or online, we will keep a note of it. Thank you for a wonderful suggestion and feedback. Our team will be taking a note about it. And
even the buzzer session maybe also, ma'am, because it was so confusing. We could not like concentrate on the chat and also on the question. We were not knowing if the options in the chat were given by a previous team or it was of a previous question. So if the quizmaster would end each question by putting out a question number or something in the chat, there was a demarcation. So like at the end, when we were ready with the answer, we were also confused if there was a option being typed or not. So in the chat, if we could get to know, so that would have in the buzzer round, the chat was a little confusing.
For this round, our team has recorded the video, and also it was played on YouTube. You can go through it. Everything.
Yes, ma'am. Yes, ma'am.
Yeah,
ma'am. For on our side, ma'am, just before we give the answer, we wouldn't know if some team had already answered. So for that part.
Okay, sure. We'll keep a note about the 3rd round as well. So not to worry about it. And congratulations to you guys. You have got a cash prize of 5,000 rupees.
Thank you.
Wow,
Thank you, ma'am.
very good. Ma'am, see Delhi. Very nice. So
thank you, ma'am.
Let's go to team B.
Hello, ma'am. Am I audible, ma'am?
Yes, you are.
Okay. Thank you, everyone, for such a good opportunity, actually. And it was a good, good platform also. For me, I felt like the same like Team A told me. It's the 3rd round, which was the buzzer round, was a bit confusing for me too. Because same, don't know whether another team already given the answers or not, and there is no demarcation between the questions, so confusions were there regarding the 3rd. And I felt like that the quiz was a little bit मतलब थोड़ा सा extended हो गया. It was a little bit time consuming and exhaustive for the team members.
Yes. Even we thought it will be a 1.5 hour quiz, but it became like a lot of time. So we will check on the
time. Not sure, but it was good in one aspect, but थोड़ा सा lengthy type का लग रहा मुझे.
Okay. Even we felt that it was quite a lengthy quiz, and we will make a serious note about it. Next time we will keep it compact.
And I'd like to congratulate all the winners here. Congratulations all.
Okay. So next we'll go with team C, their experience and their suggestions and feedback.
Thank you, ma'am. Firstly, I want to thank Ria ma'am personally, because I had contacted her. I being the first MD student in our college and having no other co-PGT, what should I have done? I wanted to participate. So she suggested me that you can go and find another from another college. So because your banner only shows that 2 PGTs from the same college, but she granted me this opportunity of participating with another student of another college. So thank you, ma'am, for this. And this first time experience was very good. And I also want to thank my friend who agreed to be my partner. And so that's why we could participate. And we didn't even thought of coming to the final round, honestly speaking. In the first prelims, we thought we will not be able to do it. So coming to this finale is a lot to us. That's enough.
Okay, that's a very good team spirit and very good spirit. Sportingly you have taken. Any suggestions you would like to give us?
Ma'am, third round, buzzer round is a bit confusing. We found buzzer round confusing. So
it is because of the chat box thing, no? Chat box, that's why it got confused. Okay, we'll take note of it. Next time we'll design, if we are designing a quiz, we'll design the buzzer round a bit differently so that no one has any confusion like this. Because this is also our first time organizing, and we thought like chat box is the easy way to manipulate, but thing is that the demarcation is not there. That's the problem. And secondly, you just not need to thank me. You can thank the whole team, because I informed the decision. Everyone based on the team decision that okay, since you are the only PG one, the 2 team members have to participate. That was a mandatory thing. Solo participation was not accepted. So that's why we, in your case, because it's a special case, we accepted your request and we told you to seek a team member, and you did also within like days. So that's really great. And your team member, I also congratulate her for making it to the finals, and thank you for participating.
Thank you, ma'am. Thank you, ma'am. Thank you, all the patrons. Thank you.
Team D, the first runner-up.
Hello, am I audible?
Yes.
Yes, first of all, I would like to congratulate the Quizmaster, Dr. Pracheth sir, and the organizers, Ria ma'am, Rubina ma'am, Dr. Teja, Dr. Haripriya. It was a wonderful opportunity and we enjoyed a lot, and it was a really great learning experience for all of us. And as far as the rounds are concerned, my experience was like the third round was, which was the game changer round for us. Actually, it required a great deal of coordination between the team members. So that was our plus point here, which I noticed. And I would like to congratulate all the other participants. Like participation was more important than winning here. So you all are winners, and congratulations to all of them. Thank you.
I'm so happy that I have been a part of this quiz competition. Thank you, everybody.
Okay. Thank you very much. Any suggestions you would like to give Team D?
Yes, I would be giving suggestions like, as my teammate have already pointed out, the coordination between teams was very important for the third round. And I was like, my fingers were on the letters and his finger was on the enter button. So it was very fast for us to give the answers. So, and other than that, for the round 1, I like the concept of creating separate rooms, ma'am. That was an innovative idea. And thank you.
Okay. Thank you very much. Thank you, Team D. You have played extremely well, and congratulations for becoming the first runner-up of our national quiz competition.
Thank you so much.
Thank you, ma'am.
Next is our Team E, who is our second runner-up.
It is a very well organized quiz, ma'am. First, I like to thank the organizers for organizing such a great quiz. It is like very tough to conduct a quiz which is in an online platform. And my suggestions would include, like, you can add other certain rounds like Pictionary, inclusion of crossword puzzle. Those rounds would be like more fun to add, more fun to have. So that is one of my suggestions. Now, another one is I add only one issue, that is like with respect to the round 3, which the participants had responded directly to the scorekeeper or some other person. It should have been more transparent, like everyone should be able to see which participant has responded first. So that one, if that instruction would have been more clear, that would have been a better one. Other than that, it was very well organized quiz.
Thank you so much for the opportunity.
And I congratulate everyone also.
Okay, thank you very much, and congratulations for becoming our second runner-up, Team E. So it is for all participants to be a part of this quiz and have performed extremely well. So I would like to thank Dr. Pracheth sir again to become our quiz master. And so I will like to call Dr. Pracheth sir to announce the prize money and all this.
Dr. Pracheth sir is actually logged out. I think he has he had some work to do. That's why he has logged out.
Okay. So we will be announcing, Dr. Ria, you can announce the winners and how they will be getting their prize money.
Yes.
And yes, etc.
Okay. Thank you, Dr. Rubina. So team A is the winner. Team B is has the second prize, first runner-up, and team E is the second runner-up getting the third prize. So the prizes are as follows, as we have displayed over the days. That is 5,000 rupees cash prize for the first prize, 3,000 for the second prize, and 1,500 for the third prize. Now, what you can do is, for the teams who have won, we will personally ask your email address. Okay, if it's better that we'll have your email address, and then there we will communicate with you to please send your account details or your UPI or whatever is convenient to you. So you can then share us that, and then we will send the prize money there. Within 2 or 3 days, we will send the prize money to you assuredly, and with the prize money at that time only we will share the certificate also, the prize certificate. So both the things will be shared to you at the same time, and we will just communicate to you via mail today only, and you can get back to us, and then we can distribute the cash prize and the certificate too. So this is basically the procedure. I hope is simple, and any confusion you have, you can mail us. I'll share my screen for all the participants who are there and the YouTube members. This is the official email address of ours, IACFM7official@gmail.com. IACFM7official@gmail.com. So this is basically our email address. So we'll be contacting you directly from our side, this email address, and any confusion you have after that, anything that we can share, we will communicate through the email address after this. So after this, the WhatsApp group, basically we will not communicate through that. So we'll announce also the team winners shortly, like by tomorrow. We will announce it publicly, and then we are hoping to see you in the next events also. We have a lot of events lined up. We usually have monthly webinars. Okay, we have been having webinars since January. So now this the quiz will be conducted. We have a webinar lined in August, September, and October. For now, that is finalized. So please, we would like you to be part of that. And and after that, if you want to become IACFM member, that is also very much good, because after that everything becomes free. Every participation becomes free. Some of our events have a certain registration fee. Some who are very low, like 10 to 20% are free. Mainly 80% of our events are for registration fee basis. So everything can be made free if you just become IACFM member. So I would highly suggest that you become the member. We have already a very large membership base, and so we would like to welcome you on in our association. We take regular feedbacks from there. We share our updates there. You get the first chance to participate there anyways. So this is why you can communicate with us, and also irrespective of that, please look out for our future events, and we will be very glad if you come there and join us. So I would like to end it here, and thank you so much again for participation, and congratulations to all the winners. Okay.
Thank you, ma'am.
So Dr. Rubina, shall we end? Or Dr. Teja wants to say something? Dr. Teja?
No, ma'am, you can carry on. It's already late. I think everyone is late.
I
just want to thank and also congratulate everyone who had participated.
Okay.
Yeah, we can end the session over here. Congratulations, everybody.
Okay,
Yes,
bye.
congratulations.
Bye, everyone. Have a nice weekend.
Same to you.